Coronavirus. Facts, not fear, starts now.
Good evening and welcome to Coronavirus Facts, Not Fear. I'm Shannon Heggie here at WPRI 12 in Providence, Rhode Island. For the last few weeks, we've been bringing you stories from around the country right here on this digital platform about how people and politicians are handling the COVID-19 pandemic. President Trump and the Coronavirus Task Force held another media briefing this afternoon with some sobering headlines. New York suffering its biggest daily death toll. President Trump also saying he has no plans for a national stay-at-home order, leaving that decision to state governors. And the CDC now saying all Americans should wear cloth face coverings while out in public. But the president says that is voluntary and something he is not going to do.
Well, I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good. I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I just maybe I'll change my mind, but this will pass, and hopefully it'll pass very quickly. Now, with that being said, if somebody wants to, I mean, most people can just make something out of a certain material, so it's very well designated. It's very simple to do. I won't be doing it personally. It's a recommendation, okay?
As for the numbers in the U.S., there are more than 276,000 positive cases and more than 7,300 deaths. It's something every state is dealing with, and one of the best ways to combat that is getting the critical supplies those frontline workers need. Now let's head down the East Coast to CBS 17's Angela Taylor in Raleigh. And Angela, North Carolina is receiving more supplies, but it might not be enough still, huh?
Shannon, you're correct. Today, Governor Roy Cooper said we did receive some supplies to help our local hospitals, but it is simply not enough right now. As you know, as you mentioned, every state is running low on supplies. The state received more than the number of procedure masks requested, but not as many N95 masks, gowns, gloves, or face shields the state asked for. The state's emergency management director says the national stockpile has been depleted. Governor Cooper now saying President Trump needs to step in and help.
This is a bad situation, folks. North Carolina has received 3 shipments from the Strategic National Stockpile. We're grateful for these supplies. But to be clear, we've gotten just 33% of what we've asked for. And they've told us not to expect more anytime soon.
So Governor Cooper added that companies in North Carolina have agreed to start making personal protective equipment for our hospitals. And one place we know that is helping is NC State, North Carolina State University. They're making masks and protective gear for those on the front lines of COVID-19. The university is manufacturing filtering material that can produce up to 500,000 masks a day. Now, it's called spun bond, and the fibers are strong enough that the mask and gear they make can actually be cleaned and reused. Well, we know a lot of businesses are struggling to stay afloat right now, and especially our local small businesses. As CBS 17's Russ Bowen tells us, there is help out there, but the demand is great.
We hear a lot about North Carolina's bigger cities like Raleigh and Charlotte and Greensboro, but the soul of the Old North State is here on our small town main streets. The once vibrant sidewalks in towns like Kenly would usually be ready for spring. Now instead we see Pray for America and We Are in This Together, slogans punctuated by the lone sound of a train and silence.
My concern is not only getting through this, but how do we come out of it, and how are we prepared to move forward once this passes?
The Golden Leaf Foundation and the NC Rural Center are partnering together to save North Carolina's small businesses. They've worked together after hurricanes and floods and are doing so again.
This also is a natural disaster, just very different in scale and in magnitude, and nobody alive has ever seen or experienced exactly what it is we're going through, and the magnitude and the scope of it is quite humbling.
Of North Carolina's 100 counties, 80 are considered rural, and local mom and pop shops are a vital part of the economy.
Here's a challenge that they're going to have to take on more debt. That's one of the reasons the board approved this as a 6-month no interest, no payment loan to help bridge from one loan to another.
This next 30, 60 days is really critical for those small business owners. They're having to make real-time decisions about whether to keep employees, whether to let them go. They're having to decide what bills to pay or whether to pay any of them. So they need help fast, and this program really is designed to meet that emergency need.
A need that is so great, there were more than 500 applicants the very first day the program launched. Now they're reaching around 2,000. A sign that the need is great, but so is the effort to save each and every storefront. Russ Bowen, CBS 17 News.
Yeah, and with so many places closed and festivals being canceled, tourism numbers here in North Carolina are down. Motels, more than 75 events and festivals have been canceled. Hotels have seen a 75%, or actually a 26% drop in occupancy, and events canceled through Visit Raleigh results in more than $27 million in economic loss. That's not good. Now, with so many people out of a job, people are getting creative to make a little extra cash. Christopher Edwards almost every day this week near our station here in Raleigh. A full-time restaurant worker. He doesn't have a job right now, so he's earning cash by playing music for people. And right now, Shannon, he's actually working on getting a permit from the city so he can do this as a regular job, and he's hoping to make this a full-time gig sometime in the near future.
And spreading some joy at the same time, too. Nice to see.
Yes.
All right, Angela, thanks. While staying at home, your lawmakers are working on the next steps in the battle to save lives, jobs, and the economy during the coronavirus outbreak. As Washington correspondent Kelly Meyer found out, lawmakers are divided on what should come next.
We are going to need probably at least one more round of stimulus investment.
North Carolina Democrat Congressman G.K. Butterfield says lawmakers are already at work on more coronavirus relief funding. He says he's been talking with his colleagues about rolling out a large infrastructure package in the coming weeks.
Infrastructure is very important to Eastern North Carolina because it will include rural broadband.
South Carolina Congressman Joe Cunningham says he wants to help the struggling food and beverage industry in his state.
Something I've talked to the leadership directly about, making sure that the tourism, food and bev industry, I mean, it's the backbone of our economy down here, and it's hurting.
As these Democrats are pushing for more relief for their communities, Speaker Nancy Pelosi is on board. But Republican leaders in the House and the Senate and at the White House have a different take on what should happen next.
Let's wait and see.
Larry Kudlow, the president's chief economic advisor, wants to let Phase 3 take effect before taking any more action.
There's no doubt that the most prudent decision we can make is to see how Phase 3 impacts the American people.
South Carolina Senator Tim Scott says Congress shouldn't rush into the next phase. Scott says we should wait and see how much more help the country and the economy need. In the meantime, Kudlow says the president remains ready to act.
If we need to do more, we will do more.
Congress won't take action on any plan until lawmakers return to Washington toward the end of this month. Reporting in Washington, I'm Kelly Meyer.
Thank you, Kelly. And now we're going to head out to the Midwest. Fox 4's Lauren Halifax is live in Kansas City now with more from there.
Good evening. After weeks of pleas from mayors in Missouri's biggest cities, St. Louis and Kansas City, and state health care leaders, Missouri Governor Mike Parson issues a statewide stay-at-home order. Missouri now becomes the 42nd state to issue that mandate.
To stay ahead of the battle, as the governor of the state of Missouri, I'm ordering a statewide stay-at-home Missouri order for all Missourians beginning at 12:01 a.m. Monday, April the 6th, until 11:59 p.m. till Friday, April the 24th.
This order requires... Kansas City Mayor Quentin Lucas says he's glad that the governor made that decision, but it should have happened sooner. In the meantime, seniors at the University of Kansas Medical School now have the option to graduate early if they help fight the virus. KU Med School already scrapped the final rotation requirements for students who are about to graduate, but now those students have an option to graduate early if they volunteer to work in Kansas hospitals where they're really needed most. Fox 4's Kara Mashik reports.
Hospitals around the country are swelling, overrun with patients, many affected by COVID-19.
As healers, our hearts pour out to the communities that are suffering.
But with the peak still weeks away in Kansas, the state is now preparing for a potential surge in beds needed and extra doctors to care for the sick. But finding more caregivers, especially in rural parts of the state, is extremely difficult. In fact, in about a third of Kansas counties, there are less than 2 doctors.
The big concern is for us is that these towns that have hospital systems that are marginal at best, and in terms of their capacity and in terms of the resources that they have, to then add the burden of trying to handle patients from a pandemic could be overwhelming.
Former Kansas Governor and physician Dr. Jeff Collier approached KU's president about allowing med students who've completed all their credits to graduate early. The idea to get those new doctors to volunteer to work in rural hospitals to alleviate some stress on the healthcare system. Daniel Ortiz is answering the call.
I wanted to find a way to do something for these patients and to do my part to help out. You know, that's what I went to medical school for, was to help and to make a difference.
Already more than 60 medical students have volunteered to head where they're needed. Dr. Kennedy says they'll undergo some intensive training, and with the help of KU surgeon and Kansas National Guard physician Dr. John Alley, the students will be matched with the hospitals all across Kansas in the coming weeks.
Just the response to this entire situation is sort of extraordinary. I think it's really brought out the best in people.
And did you catch that? These newly graduated doctors will be volunteering their time to help out during this crisis. They can apply for some stipends to help cover some of their expenses. That's thanks to a generous $1 million grant from the Patterson Family Foundation. KU says they hope that this program will become a national model during the COVID-19 pandemic going forward. I'm Lauren Halifax in Kansas City. Now back to you in Providence.
It's a great thing they're doing. Thanks, Lauren. Here in Rhode Island, we learned today that makeshift hospitals are being set up around the state, preparing for a surge in COVID-19 cases. 54 new cases today, bringing the total in Rhode Island to more than 700. Our Ted Nesi has more now from Governor Gina Raimondo's daily briefing.
Rhode Island leaders really operating on 2 tracks right now. They continue asking residents to help slow the spread of the virus while taking steps to prepare for what they consider an inevitable surge of infections.
This is a top priority for us.
The Rhode Island National Guard designating 3 sites as temporary field hospitals: the Convention Center in Providence, this old Citizens Bank building in Cranston, plus a former Lowe's store at Quonset, all set to be outfitted with hospital beds.
Right now we have over 1,000 that we are planning for. I would sense that based on some of the data points that need to be refined later in the week, we'll certainly get to a point where we'll try to double that availability.
Officials still seeking help from any active or retired health worker.
So I'm asking you again, asking you, begging you, imploring you. Hundreds of you have already signed up. If any of you haven't and you have any capacity, riresponds.org, we need you, and we need you to sign up now.
The health department now urging Rhode Islanders to wear cloth face coverings when they go out, though medical masks aren't necessary.
We recognize that there may be times people are not aware that they have some of those mild symptoms. And so being able to cover yourself helps protect from other people being exposed.
Despite more than 700 Rhode Islanders testing positive for COVID-19 since the outbreak began, the governor says police checks show a significant number of residents still aren't complying with her stay-at-home order.
I need you to stay home. We don't have enough ventilators to keep everybody safe if the surge hits sooner than we think, or if the peak is higher than we think. We don't. More people will die.
And the health department says this new advice about covering your face is because they keep getting new information about how COVID-19 spreads, and they're finding the symptoms can be quite different in one patient versus another. Fundamentally, though, their advice is the same. If you feel at all under the weather, stay at home. At the State House, Ted Nesi, Eyewitness News.
Thank you, Ted. All Rhode Island state parks and beaches and their parking lots are closed until further notice. Our cameras captured this scene at Lincoln Woods State Park this morning. The areas are being patrolled by DEM police and park staff. And let's head out west now. We go live to Aristea Brady from KDVR in Denver for more on what's happening out there. Aristea?
Shannon, the first Denver inmate to test positive for COVID-19 says he should have never been allowed into the general population there in the jail in the first place. Fox 31 investigative reporter Rob Lowe telling us tonight, in fact, the nurses should have known better.
2 days after we broke the story that a Denver inmate was placed into the general population despite telling deputies he had COVID-19 symptoms, the inmate himself is speaking out. He says nurses are lying about him to cover up for the fact that he was placed into the general population when they should have known better. Should you have ever been brought to jail in the first place, in your opinion?
Not at all. It was a low-level misdemeanor.
We've agreed to protect the identity of Denver's first inmate who tested positive for COVID-19, but it's worth noting that low-level misdemeanor for harassment was dropped by prosecutors the day after he was released.
As soon as I mentioned that I had symptoms, I think they should have taken all precautions and given me a test right away.
Instead, because he had no fever, he says a nurse moved him out of isolation and into the general population. Denver Health previously told Fox 31 it was because the inmate told a nurse he admitted lying to ever having symptoms.
Why are they trying to say that I lied when they screwed up in their procedures? They never should have put me in general population.
It was only hours later, when the inmate came down with chest pains, that he was rushed to Denver Health, where he tested positive for COVID-19. How do you feel about the fact that you may have exposed other inmates and certainly several deputies?
I feel bad about it, but I know it wasn't my fault. I was just doing what they told me to do.
Simply because it's a public health crisis.
Denise Mays is with the ACLU. Today, the organization asked Colorado's Supreme Court to issue clear guidance to county jails to depopulate by only accepting suspects accused of the most serious crimes.
Over half of the jail population is innocent. They're pre-trial. They haven't been convicted of any crime. And really, the jails are kind of a petri dish.
To slow transmission, she says jails need to reduce population. And the inmate says those who are booked need to be better screened.
I was honest from the very beginning because I have no desire to infect anybody with anything.
That inmate tells me he's feeling better, though he's at home self-isolating based on guidelines from Denver Health. Denver Health says those nurses are not facing discipline for mixing the inmate into the general population, even though he exposed 2 inmates and up to 16 deputies. Rob Lowe, Fox 31.
Rob, thank you. And meanwhile, just today, more than a dozen Denver metro schools announced that they will not continue in-person classrooms through the remainder of the 2019-2020 school year. We should, however, tell you thousands of students have already begun their remote learning online since they returned back from spring vacation. Reporting live from Denver in my home studio, Aristea Brady. Back to you, Shannon.
Aristea, thank you. And now to the latest on the coronavirus situation in Massachusetts. The state has begun a major effort to trace all of the cases. The COVID-19 Community Tracing Collaborative will be operated with Partners in Health. A virtual call center will be staffed with nearly 1,000 people and will attempt to reach out to the close contacts of every person who tests positive for the disease.
By monitoring and isolating through an enhanced community tracing program, our state can be positioned to reduce the number of cases, new cases, in the long run.
Governor Baker also announced that a new drive-through testing site for first responders only will be opened on Sunday in the parking lot at Gillette Stadium. More than 300,000 N95 masks from China have made it to the Jarvis Center in Manhattan, and it's all thanks to Robert Kraft, the owner of the New England Patriots. Our Maury Hirsch-Gordon shows us how the masks got there.
More than 1 million N95 masks arriving at Boston's Logan Airport Thursday night in a Patriots team jet. And by Friday morning, Rhode Island State Police Colonel James Manny confirming the state will receive 100,000 of them. Manny says REMA will get the masks on Friday in Marlborough, Massachusetts.
That we work best when we work together.
Massachusetts Governor Charlie Baker could hardly contain his emotions, thanking Robert and Jonathan Kraft for their efforts.
Jonathan. Honestly, we can't thank you and your dad and your family enough for answering the call for helping make this happen.
Patriots running back James White says stepping up to help the community in times of need is a pillar of the organization.
That's very important. I think as soon as you step into the building, you see how much the Kraft family does with helping out not only the Boston community, but the community across the world. And it just helps you, makes you want to help others.
This is a moment that for the past few weeks, the Lieutenant Governor and I hoped we'd be here to celebrate, but never knew if it would really happen or not.
And of the shipment of N95 masks coming over from China, 300,000 of them will be donated to New York. Robert Kraft says the state has played an integral role in his life. Maury Hirsch-Gordon, Eyewitness News.
Thank you, Maury. And now let's go live to Samantha Cortese and Andy Reesmeyer joining us live from KTLA in Los Angeles.
Yeah, LA County is emerging as the hotspot of COVID-19 in California as cases top 4,500 today. 521 new cases were reported. Leaders at the Department of Health say LA County should expect to see as many as 1,000 new cases a day in the coming weeks. Of the infected, 321 are confirmed cases in institutional settings. That would include things like nursing homes and prisons. In California, more than 11,500 people are suffering from the disease. 250 have died. Sam?
Andy, a second Riverside County Sheriff's deputy has died from COVID-19. Deputy David Worksman served the department for 22 years. He was also a hazmat specialist and a nuclear responder. He's survived by his wife and 3 children. Sheriff Chad Bianco says Worksman may have contracted the virus while planning or attending his mother's funeral several weeks ago. And a deputy died yesterday as well. Terrell Young was a 15-year veteran with the Sheriff's Department in Riverside County. They say Deputy Young transported an inmate infected with COVID-19 on March 16th. Deputy Young started showing symptoms, including a fever, on March 22nd and went home. 10 other deputies also called in sick with symptoms that day. We don't yet know if Deputy Worksman was one of them.
And LAPD officers will now wear masks or non-medical face covers as a precaution. Police Chief Michael Moore made the announcement as the number of police officers infected with COVID-19 has risen to 35. The LAPD continues to test its employees. The department is also taking the temperatures of their officers when they arrive for their shifts. Workspaces are being sanitized, and officers are equipped with N95 masks, gloves, and goggles if needed. Sam?
And where else would you see a paddleboarder finding himself in a fight with the law while catching a wave? This was at the Malibu Pier. Deputies were flagged down by lifeguards about a man in the water disobeying orders to get back on the beach. He finally complied and swam to shore. He was arrested for violating the city's order that closed the beaches. But in Surf City, USA, Huntington Beach, the beaches are still open, and they're even tweeting, the city is, places to park. But what is closed? The grass areas around the beach. Huntington Beach is closing those grass areas in an effort to stop the spread of COVID-19. The city's installing 500 signs along those grassy areas to remind the public that it's closed. A large part of grass between a very popular set of streets will be fenced off. So if surfers are looking to catch a wave there, they got to get around all of that first. Andy?
One of the strange side effects of the lockdown, of course, have been little to no traffic congestion on the roads. But police in Washington and Oregon are reporting a dramatic increase in speeding. One state trooper in Washington told Como News that we are seeing some very high, very disturbing speeds, some over 130 miles per hour. In Marion County, Washington, several drivers were said to be stopped going more than 100 miles per hour. The governor of that state has extended Washington's stay-at-home order until at least May 3rd. 271 people have died in Washington of COVID-19. 6,389 are infected. Sam?
And that is it for the West Coast. We'll send it back to you.
Samantha and Andy, thank you. All week, we've been bringing you stories about the helpers stepping up during this difficult time. People across southern New England have been lending a helping hand to neighbors in need and to frontline workers. And earlier this week, we told you about the Community College of Rhode Island donating masks, gowns, hand sanitizer, and more to the Department of Health. West Warwick students are also using their free time to make face shields for healthcare workers. We also told you why teddy bears are popping up in windows across the country. Kids are going on scavenger hunts in their neighborhoods looking for the bears. It's a safe way to pass the time and a way to put a smile on everyone's face. And in Charlestown, residents are putting candles in the windows, shining a bright light to honor first responders. Before we go, a quick reminder of the symptoms of coronavirus. The primary symptoms: fever, cough, and shortness of breath. The CDC says call your doctor before going to a clinic or hospital to get tested. And if you feel sick, please stay home. The goal of our Nexstar family is to make sure you continue to get the latest facts on the coronavirus without the fear. For now, I'm Shannon Heggie. Thank you for joining us. Please stay healthy and enjoy a good night.